Hi, my name is Gavin Jennings. I'm a consultant orthopedic surgeon who specialises in shoulder problems. Many of the questions I get asked by patients about shoulder conditions come up again and again. And in this short video, I'd like to share some of the answers to the common questions I get asked about frozen shoulder. Frozen shoulder is a condition where the shoulder becomes increasingly painful and more stiff over time. There are other causes of a stiff and painful shoulder, but this is a specific disease. Frozen shoulder can occur in most age groups, but it is commonest in people in their 40s, 50s, and early 60s, and slightly more common in women. And certain groups, such as diabetic patients, are particularly prone to getting this condition. Frozen shoulder symptoms can come on fairly gradually. The sufferer often starts by noticing an aching around the outer part of the shoulder, sometimes at the front. And activities such as reaching behind or reaching out suddenly become painful. If the shoulder is jolted or thrust out rapidly, then the patient may notice really excruciating pain, and that can last for a few minutes or even hours. The symptoms are often particularly troublesome at night and can often disturb the sleep. Occasionally, the sufferer may notice some sort of nerve type symptoms such as tingling and shooting pains heading down the arm. Frozen shoulder occurs when the lining of the ball and socket joint in the shoulder becomes inflamed. Abnormal cells then form in the capsule around the joint. These cells behave like a mixture between sort of muscle and scar forming cells. So they lay down scar, and then to add insult to injury, they then contract like muscle cells. So these changes explain the pain and also the stiffness that develops in the shoulder. Although we know what happens in frozen shoulder, no one really knows exactly why it happens. So frozen shoulder can come out of the blue, which is known as primary frozen shoulder, or it can come on after another shoulder problem, and this is known as secondary frozen shoulder. There are other certain conditions such as diabetes and thyroid problems which have an association with developing frozen shoulder, and even some medications can increase the risk of getting one. The standard answer to this is about 1 to 3 years without treatment. However, symptoms can last significantly longer, and there's good evidence that in about 10% of people, the symptoms will last for good. There's also evidence that in the majority of cases of frozen shoulder will improve over time, but if untreated, there will almost always be some residual lack of movement in the shoulder. There are a number of treatments that have been used for frozen shoulder, and some are certainly more effective than others. Physical therapy can be of some help in terms of improving symptoms, but there's not a great deal of evidence that when used alone, it can change the natural course of the problem. Steroid injections into the ball and socket have been shown to be a benefit, and combining steroid injections with physiotherapy has been shown to be even better still. If these conservative measures don't work, then surgery can be considered. The modern approach for this is to perform a keyhole release of the tight structures in the shoulder. There are a number of other treatments, some of which have conflicting evidence as to whether they work, and some of which are just not worth trying at all. There is some evidence that the earlier a steroid injection is given, the better. And I usually say to people, therefore, that they're best off initially seeing someone who's able to provide such an injection. If a steroid injection and physical therapy have not led to significant improvement, and you've not already involved an orthopedic shoulder specialist in your care, then that's probably the time to do so. The short answer to this is no. An experienced clinician will have no trouble at all in diagnosing frozen shoulder, and an MRI scan is rarely needed. If though there were thought to be other potential problems in the shoulder, such as in the case of secondary frozen shoulders, then a scan may be suggested. There are some changes that can be seen on the MRI scan, which are suggestive of a frozen shoulder, but the patient's symptoms and examination are normally more than enough to make the diagnosis. Again, the short answer to this is no. The evidence suggests that if someone's had a genuine frozen shoulder, which is fully resolved, then they're unlikely to get the same condition again in the same shoulder. Not infrequently, I see patients who present with a frozen shoulder and they've been told that they've had it in the past. Closer questioning, however, usually reveals that the initial diagnosis, maybe some years previously, was probably incorrect. There's no doubt, however, that if you have had a frozen shoulder, you can subsequently get the same problem in the other shoulder. This more often occurs as two separate events, but occasionally both shoulders can become frozen at the same time. Slightly, if you've had one frozen shoulder, you're probably at a slightly higher risk of developing another frozen shoulder on the other side when compared to the general population. There's absolutely no doubt that diabetics have a significantly increased risk of developing frozen shoulder. It's likely also that the symptoms may be longer lasting and more difficult to treat. There are a number of theories as to why the problem may be more common in diabetics, including those based on abnormalities with collagen or scar formation and formation of new blood vessels, which we know occur in the diabetic patient. But don't worry, I'm not going to bore you anymore with any more details on that. This, in my view, is an excellent question to ask anyone who's treating you really for anything. Fortunately or unfortunately for me, I've had frozen shoulder affecting both sides, and I can therefore give you a genuinely accurate answer as to what I would and indeed did do. So I had steroid injections into both of my shoulders. Unfortunately for me, they improved my symptoms significantly. I've been left a little bit stiff in both shoulders, but I've no pain. And although my days as a trapeze artist are probably over, the stiffness doesn't cause me any issues or any functional restrictions other than that. Had the injections not have worked, I almost certainly would have gone down the line of an arthroscopic or keyhole release of the shoulders. I hope you found these answers to some of the common questions I'm asked about frozen shoulder helpful, but please do not hesitate to contact me if you need any further information. If you've liked this video, please give it a thumbs up and feel free to leave any comments. Thank you.